Hi, Miss Anderson.
Hello.
This is my instructor, Miss Lane. She'll be working with me today, okay?
Hi, Miss Lane.
Hello.
Okay, so I know the doctor talked to you about the tube for your stomach. I'd like to put it in now. Once it's in place, you won't feel so nauseated and you won't vomit.
Will it hurt?
This is an uncomfortable procedure. Some patients say it's painful. The good news is that once the tube is in place, you may notice it, but it won't necessarily cause pain. Your throat may feel a bit sore afterwards, but we can get the doctor to order some spray to help with that.
Oh, sounds good. I trust you'll do your best.
I will absolutely make this as easy as possible for you. Would you like me to obtain a prescription for a topical anesthetic such as lidocaine gel or spray for your nares before we get started? Some people find that helpful.
No, I can handle it.
Okay. Can I check your ID band, please?
Yeah, sure.
Could you state your full name and date of birth for me?
Hannah Andresen, November 4th, 1993.
Okay, good. Now I'm just going to raise the bed a little bit, okay, to get you a little bit more comfortable.
Sure.
Okay, how's that?
It's good, thanks.
All right, good.
Go ahead and lay out your supplies.
Okay.
Be sure to have an emesis basin and tissue within reach during the procedure. And remove one of the strips from the bottle so you can test the pH to confirm placement.
Okay, got it. There's some tissue for you, okay?
Thank you.
Okay. Close one nostril for me, Miss Anderson, and then the other, and let me know which one is easier for you to breathe out of.
Okay, this one is.
Okay, that's the one we'll use, okay?
Okay.
So I'm going to cover you up with this waterproof pad.
Thanks.
And here's an emesis basin that you can keep nearby, okay?
Now you'll need to measure and mark the tube. Go from the nose to the tip of the earlobe. Then down to the tip of the xiphoid process.
The policy at this facility requires that I add 10 centimeters to the estimate. So I'll add that to my measurement and indicate my target on the tube with my marker. I'll also look at the markings on the tube as a guide.
Good.
Now I will open the kit. Here's some water you may want to sip on once we're underway, okay?
Okay, thanks.
Just gonna put this side rail down.
Now lubricate the tip of the tube about 2 to 4 inches with water-soluble lubricant. And have Miss Andreasen flex her head back slightly against the pillow and insert the tube, directing it upward and back along the floor of the nose.
All right, you might feel some pressure here, all right? Okay. That's the worst part. Go ahead and catch your breath for a minute. All right? Okay, the tears are a totally natural response, all right? I've got tissue here if you need it, all right?
Thanks.
Okay, good. Now this next part is a little uncomfortable. You might gag a little when it gets to the back of your throat, okay?
Okay.
But hang in there for me, all right?
All right.
It'll be over before you know it.
Okay.
All right, you're doing good. All right, now can you lower your head, touching your chin to your chest, and drink the water from the straw?
Be sure to advance the tube downward and backward when she swallows, and don't force the tube.
Good job.
You can rotate it if you meet resistance.
Okay.
Now, if your patient were gagging or coughing, you'd want to stop advancing the tube and check placement with a tongue blade and flashlight.
Just a little more. Okay, we're at the marking. You can relax now, okay? Go ahead and lift your head up for me.
That went well.
Easy for you to say.
Good job, Miss Andreasen. I'm going to secure the NG tube loosely with a piece of tape while I check for placement.
I got that for you. Now, check the pH to make sure the tube is in the stomach. Aspirate a small amount of stomach contents.
I'll be assessing color and consistency. Gastric fluid can be green with particles or brown if old blood is present. Intestinal fluid may be clear to straw colored or a bit greenish brown if stained with bile. Although I don't see any, a small amount of blood would be normal immediately following insertion. This looks normal. The brownish green coloration is indicative of bile, which is found in the stomach.
Now, when testing the pH, what range are we looking for?
Stomach contents are acidic and have a pH less than 5.5. And this is in range.
Very good.
Thanks. I'm going to take the tape off the tube, okay? All right, put this tape here. Sorry. Just gonna remove this tape, okay? You're doing good. Okay, I'm just gonna apply something to your nose to protect it from the tape, okay?
Okay.
All right, I'm gonna let that dry and then I'll secure the tube, okay?
Okay.
You doing okay?
Yeah, I'm all right. Thank you.
Almost done. Okay, just one more piece of tape. How's that?
That's good.
All right, good.
Great. And now measure the tube from the tip of the nose to the end of the tube. This measurement will help determine proper placement later.
Okay. Now I'll just reinforce the marking at your nostril. And then secure the tube to your gown. Can you turn your head that way for me? Okay. Good. You can turn your head back now.
You did great, Miss Andreasen. Will you be needing any assistance with oral hygiene now?
No, I think you two have done enough. I can brush my own teeth.
Okay. We'll have you brush every 2 to 4 hours to help keep your mouth clean and moist. It can help you be more comfortable and it reduces thirst.
Nice job. When you document the procedure, be sure to include the type and size of the tube used, the nair used for insertion, the measurement of the exposed tube, and the characteristic of the drainage in the tube, and Miss Andreasen's response to the procedure.
Do you need anything else before we finish up here?
No, I'm okay. Thank you.
Good.